Did you know that some of the most common fruits on American tables could be quietly undermining the health of people over 60? Sounds impossible, right? After all, we've been taught since childhood that fruits are good for you, natural, and full of vitamins. But the truth is, not every fruit is a friend to the mature body. A recent study published in the American Journal of Geriatric Nutrition revealed something surprising. 68% of seniors who reported bloating, digestive issues, or sudden blood pressure fluctuations regularly consumed at least 2 fruits that could be contributing to these symptoms. And the most shocking part, most of these people had increased their consumption of these fruits precisely to improve their health. Imagine Mrs. Johnson, 73, who started eating 2 bananas a day because she heard they were good for the heart. Within 2 weeks, she began to feel a heavy stomach, poor bowel function, and even dizziness upon standing. What she didn't know was that, at her age, and especially while taking blood pressure medication, those bananas were causing a dangerous imbalance in her system. This isn't an isolated case. As we age, our metabolism changes dramatically. The liver processes nutrients differently, the kidneys work less efficiently, and the gut becomes more sensitive. What was once an allied food can turn into a disguised enemy. Today I'm going to reveal 4 specific fruits that people over 60 need to avoid or consume in very moderation. It's not a matter of dietary extremism, but rather of nutritional intelligence. Knowing this information can be the difference between living with energy and vitality or dragging yourself through the day feeling unwell without knowing why. I'm Dr. Alexander King, a geriatric physician with over 15 years of experience. And my mission is to help you live with more health and quality of life after 60. Smart health for a full life. That's the medicine I believe in. First fruit, the banana, the silent danger of potassium. Let's start with the fruit that surprises people the most, the banana. Yes, that yellow, sweet, and creamy fruit that many consider the perfect snack. For people over 60, especially those taking blood pressure medication, the banana can be a dangerous trap. The issue is potassium. A medium banana contains approximately 422 milligrams of this mineral. For a young and healthy adult, that's great. But what about someone over 60 who's taking ACE inhibitors or potassium-sparing diuretics? The scenario changes completely. What happens is that many medications used by seniors already alter potassium levels in the blood. When you add bananas regularly to the diet, a condition called hyperkalemia, or excess potassium in the blood, can occur. The symptoms? Muscle weakness, irregular heartbeat, nausea, and in severe cases, cardiac arrest. I know the case of Mr. Williams, 68, who loved his 2 bananas for breakfast. He had been taking blood pressure medication for 5 years without problems. But when he decided to improve his diet by including bananas daily, he began to feel weakness in his legs and his heart, skipping a beat. Tests showed dangerously high potassium levels. Simply drastically reducing his banana consumption was enough to bring everything back to normal. But it's not just the drug interaction that's concerning. Bananas are also high in fructose, a type of sugar that the mature liver has difficulty processing. In excess, it can contribute to the accumulation of fat in the liver and insulin resistance, problems already common in older age. Do you regularly eat bananas daily? Have you noticed any strange symptoms after including it in your routine? The banana can also cause digestive problems in people with a more sensitive gut, something common after 60. Its high content of resistant starch can ferment in the gut, causing gas, bloating, and abdominal discomfort. If you love bananas, the tip isn't to eliminate them completely, but to consume them in moderation. At most, half a banana twice a week, and always away from medications. And of course, always with medical guidance, especially if you take medication for blood pressure or heart problems. Second fruit, the orange, acidity and medication interference. The second fruit on our list may be even more controversial. The orange, a symbol of vitamin C and health, the orange hides specific traps for the mature body that many people don't know about. The first problem is acidity. An orange has a pH between 3.0 and 4.0, which means it's quite acidic. For young stomachs, this is not a problem. But after 60, the production of gastric acid decreases significantly, and the stomach lining becomes more sensitive. Consuming very acidic fruits can cause gastritis, gastroesophageal reflux, and even ulcers. I remember Mrs. Davis, 71, who had the habit of drinking orange juice every morning to ward off the flu, she said. After a few weeks, she began to feel a burning sensation in her stomach, especially right after waking up. What she didn't know was that the acidity of the orange on an empty stomach was severely irritating her gastric mucosa, already weakened by age. But the problem with oranges goes beyond acidity. They contain compounds called furanocoumarins, which can interfere with the absorption of various medications. This interference is particularly dangerous with blood pressure medications, anticoagulants, and cholesterol medications. The result can be both a reduction in the effectiveness of the drug and an increase in its effects, causing hypotension or bleeding. A study from UCLA showed that regular consumption of orange juice can reduce the absorption of some blood pressure medications by up to 70%. Imagine taking your medication religiously every day, but it's not working properly because of the orange juice at breakfast. There is another worrying aspect: the sugar in oranges. A medium orange contains about 14 grams of natural sugar. For an elderly person, especially with diabetes or prediabetes, this can cause blood sugar spikes. And when consumed in juice form, the problem multiplies. A glass of orange juice can contain the sugar of 3 to 4 oranges without the fiber that would help modulate absorption. Do you have a habit of drinking orange juice in the morning? Have you noticed if you feel heartburn or changes in blood pressure? The orange is also rich in histamine, a substance that can cause allergic or pseudo-allergic reactions in seniors. Symptoms include itching, hives, headache, and even breathing problems. With the immune system naturally more sensitive in older age, these reactions become more common. If you really enjoy oranges, the guidance is to consume at most half an half orange twice a week, always after a meal to reduce acidity in the stomach, and never close to medication times. Keep an interval of at least 2 hours. Third fruit, the grape, high glycemic index and digestive problems. The third fruit that deserves special attention is the grape. Sweet, juicy, and seemingly innocent, the grape hides characteristics that can be problematic for people in their golden years. The main culprit is the high glycemic index. Grapes have a glycemic index between 59 and 64, considered medium-high. This means they rapidly raise blood sugar levels. For a senior whose glucose metabolism is already naturally slower, this can be a serious problem. When we eat grapes, especially in quantity, the sugar enters the bloodstream quickly, forcing the pancreas to produce a lot of insulin at once. In older adults, this overload can contribute to the development of insulin resistance and type 2 diabetes. And for those who already have diabetes, it can completely destabilize blood sugar. I knew the case of Mr. Peterson, 74 years old, a controlled diabetic for years. He started eating about 30 grapes a day, thinking it was a healthy alternative to sweets. In a few weeks, his blood sugar levels skyrocketed, and it was necessary to adjust his medication. When he removed the grapes from his diet, everything returned to normal. But it's not just the sugar that's concerning in grapes. They contain compounds called tannins, which can cause digestive problems in people with sensitive bowels. Tannins can irritate the intestinal lining, causing diarrhea, abdominal cramps, and malabsorption of nutrients. Grapes are also rich in fructose, a type of sugar that is metabolized by the liver. In large quantities, it can overload the mature liver, contributing to the accumulation of liver fat and inflammation. This is especially worrying considering that many seniors already have liver impairment due to medications or other health conditions. There is also an issue that few know about. Grapes can interact with anticoagulants like warfarin, Coumadin. They contain vitamin K, which interferes with the action of these medications and can alter blood clotting time. For those taking anticoagulants, this can be dangerous. Do you usually eat a lot of grapes at once? Have you noticed if you feel changes in your bowels or energy after consuming them? An additional aspect is that grapes are one of the fruits with the highest concentration of pesticides. The detoxification system of the elderly works less efficiently, so exposure to these substances can have more pronounced effects, including headaches, fatigue, and gastrointestinal problems. Raisins are even more problematic as they have a higher concentration of sugar and may contain sulfides, preservatives, that cause adverse reactions in many people, especially seniors with food sensitivities. If you like grapes, limit consumption to a maximum of 8 or 10 units per week, always giving preference to organic ones when possible, and preferably after a meal to minimize the impact on blood sugar. Fourth fruit, the pineapple, bromelain, and gastric irritation. The fourth and last fruit on our list is the pineapple. Tropical, refreshing, and rich in vitamin C, the pineapple has specific characteristics that can cause problems for people over 60. The main problematic component of pineapple is bromelain, a proteolytic enzyme. Although bromelain has anti-inflammatory benefits in specific conditions, it can be aggressive for sensitive stomachs, something common in older age. Bromelain literally digests proteins, and when pineapple is consumed on an empty stomach or in large quantities, this enzyme can severely irritate the gastric mucosa. Symptoms include burning, heartburn, nausea, and even ulcers in extreme cases. I remember Mrs. Green, 69, who started eating pineapple every day because she read that it was good for digestion. Ironically, in 2 weeks, she developed severe gastritis. The problem was precisely the bromelain attacking her stomach already, weakened by age and the regular use of anti-inflammatory drugs for arthritis. Pineapple is also very acidic, with a pH between 3.2 and 4.0. For people with gastroesophageal reflux, a common condition after 60, pineapple can significantly worsen symptoms. The acidity can relax the lower esophageal sphincter, allowing gastric acid to rise into the esophagus, causing heartburn and burning. Another worrying aspect is that pineapple can interact with anticoagulants and some blood pressure medications. Bromelain can potentiate the effect of anticoagulants, increasing the risk of bleeding. For those taking warfarin, Coumadin, or other anticoagulants, this can be dangerous. Pineapple is also relatively rich in sugar. An average slice contains about 16 grams of natural sugar. For diabetics or pre-diabetics, this can cause unwanted spikes in blood sugar, and when consumed in juice form, the problem multiplies. Do you consume pineapple frequently? Have you felt heartburn or digestive problems after eating this fruit? There is also a lesser-known issue. Pineapple can cause irritation in the mouth and tongue in elderly people. This happens because bromelain begins to digest the tissues of the mouth, causing a burning sensation, small wounds, or numbness of the tongue. For people with ulcers, gastritis, or coagulation problems, pineapple should be avoided completely. For other seniors, if there is a desire to consume it, the recommendation is, at most, a small slice per week, always after a substantial meal, and never on an empty stomach. An important tip: if you have stomach problems and like pineapple, try eating it cooked. Cooking neutralizes part of the bromelain, making it less aggressive to the stomach. We have reached the end of this revealing journey, about the 4 fruits that people over 60 should avoid or consume in extreme moderation. Recapping what we discovered today. The banana, seemingly harmless, can cause dangerous potassium imbalances, especially for those taking blood pressure medications. Its high levels of fructose can also overload the mature liver. The orange, a symbol of health and vitamin C, can irritate sensitive stomachs with its acidity and interfere with the absorption of important medications. Its sugar concentration can also destabilize blood sugar. The grape, sweet and tempting, has a high glycemic index that can destabilize diabetes and overload the pancreas. Its tannins can cause digestive problems, and the concentration of pesticides is concerning. The pineapple, tropical and refreshing, contains bromelain that can be aggressive for sensitive stomachs, in addition to its acidity that can worsen gastroesophageal reflux. It's important to understand that I'm not saying you should completely eliminate these fruits from your life. The key is knowledge and smart moderation. Each body is unique, and what affects one person may not affect another. The fundamental thing is to pay attention to the signals your body sends you, and always consult your doctor before making significant dietary changes. Nutrition after 60 should be strategic, not just healthy. We need to choose foods that nourish without overloading organs that are already working differently. There are many other wonderful fruits that are more suitable for older age. Peeled apples, ripe pears, papaya, cantaloupe, kiwi in small quantities. Remember, aging healthily is a privilege we earn day after day through smart choices. Knowledge is prevention, and prevention is quality of life. If this video added value to your life or to someone you know, please subscribe to the channel and hit the notification bell to receive more content about smart health for older adults. Share this video with your friends and family. Many people need this information and don't know it. And don't forget, the best age can really be the best phase of life when we have the right information and make the appropriate choices. Your health is your most precious asset. Take care of it with intelligence, care, and knowledge. Until the next video, and may you live each day with more health and vitality. After all, life after 60 can be extraordinary when we know how to navigate it intelligently. A warm regards from Dr. Alexander King, and I remind you, smart health for a full life. That's the medicine I believe in and want to share with you.